You're turning 65, and suddenly your mailbox is under attack. It's flooded with brochures, thick envelopes filled with strange words. Part A, Part C, Medigap Advantage. It feels like a language you were never taught, but are now expected to be fluent in. Your head is spinning, right? Let me tell you a secret. This system isn't confusing by accident, it's confusing by design. A world of complexity was built to keep you feeling uncertain, maybe even a little helpless, because a confused customer is a profitable one. But forget all of that. Forget the noise, the endless paper, the conflicting advice. In the next 15 minutes, I'm going to give you a simple map, a map that will make the entire Medicare system crystal clear, once and for all. This will be the only guide you'll ever need. Before we even touch on what those letters A, B, C, and D mean, you have to understand the most important thing. The one concept that cuts through all the chaos. Right now, in America, there are two, and only two, fundamentally different ways to get your Medicare insurance. Every decision, every brochure, every confusing phone call you get, it all boils down to this single choice between two distinct paths. Everything else is just detail. Picture a road. As you approach age 65, that road forks into two separate highways. You cannot be on both highways at the same time. You must choose one, and your choice will affect every single healthcare decision you make for the rest of your life. The first highway is path number 1, Original Medicare. This is the government path. This is the foundational program that was created decades ago. It's the system your parents likely had. Solid, dependable. But as we'll soon see, it's a path full of dangerous financial gaps. This is the path run by the federal government itself. The second highway is path number 2, Medicare Advantage. This is the private path. This path is managed entirely by private insurance companies. It's the one advertised everywhere, on every channel, promising you $0 premiums and free gym memberships. It's newer, it's shinier, and it comes with a rule book written by a corporation, not by the government. So let's be perfectly clear. Your first and most critical decision is this. Do you want your healthcare managed directly by the government, or do you want to hand over that responsibility to a private insurance company? Everything that follows, every choice about doctors, hospitals, and costs, starts right here, at this fork in the road. Now, let's look at the building blocks, the pieces that make up these two highways. I'm talking about Part A and Part B. Think of these not as choices, but as the fundamental foundation of your entire Medicare journey, no matter which path you ultimately take. They are the engine of your car before you've decided which highway to drive on. Let's start with Part A. The simplest way to think of it is this. Part A is your hospital insurance. If you are admitted into a hospital, Part A is what pays for your room and board. For nearly every American, Part A is premium-free. Why? Because you've already paid for it. For your entire working life, a piece of every paycheck you ever earned went to the Medicare tax. You've been prepaying for your Part A for decades. But here's the first critical warning. Free does not mean it covers everything. If you land in the hospital, you will still face a hefty deductible, a bill you have to pay out of your own pocket before Part A even begins to help. And if you stay in the hospital for a long time, the costs you're responsible for can start to grow, and grow fast. So remember, Part A is for the hospital room, but it's not a blank check. Next, we have Part B. If Part A is for the hospital, think of Part B as your doctor insurance. This covers everything from your regular doctor visits to specialist appointments, lab tests, x-rays, ambulance rides, and outpatient procedures. Unlike Part A, Part B is not free. You will pay a monthly premium for it, which is typically deducted directly from your Social Security check. The government sets this price every year, and if you had a higher income before you retired, you will be forced to pay even more. But here is where the real danger begins. The single most terrifying financial risk in the entire Medicare system. Part B only covers 80% of your medical bills. You are responsible for the other 20%, forever. There is no limit. There is no cap. A 20% coinsurance on $1 million cancer treatment is $200,000 out of your pocket. This 20% gap is the reason why simply having Part A and Part B is not enough insurance. It is a financial ticking time bomb, and understanding how to defuse it is the key to protecting your life savings. So now we have our foundation, Part A for the hospital, Part B for the doctor. And we have a critical problem, a massive, unlimited 20% hole in our coverage. With this knowledge, let's go back to that fork in the road. Let's explore our two highways and see how each one attempts to solve this dangerous problem. This is where the real choice begins. Let's travel down path number 1 first. You've chosen Original Medicare, the government path. You have your foundation, Part A and Part B, but you're staring into that terrifying 20% financial hole. You are exposed and you know it. This is not a complete solution. This is a house with no roof. So how do you fix it? On this path, you solve the problem by assembling a complete package yourself. You purchase additional, separate insurance plans from private companies to fill in the gaps that the government left behind. Think of it like building with Legos. The government gives you the 2 main blocks, and you buy the extra pieces to make your coverage whole. The first piece you need to add is a plan for your medications. This is called Medicare Part D. Original Medicare does not cover prescription drugs you pick up at the pharmacy, not a single one. To get that coverage, you must buy a separate, standalone Part D plan from a private insurance company. There are dozens to choose from, each with its own monthly premium, its own list of covered drugs, and its own rules. Choosing the wrong one can be a costly mistake, but having no Part D plan at all is financial insanity. So now you have your Part A, your Part B, and you've added a Part D for your prescriptions. But that 20% hole, it's still there. You still have that unlimited financial risk from your doctor bills. This is where the most important piece of the puzzle comes in. This is how you protect yourself from bankruptcy. You add the final piece, a Medicare supplement plan, also known as Medigap. The name says it all, it fills the gaps. A Medigap policy is something you buy from yet another private insurance company. You pay them a monthly premium, and in return, they pay the costs that Original Medicare doesn't. They pay your 20% co-insurance. They pay your hospital deductibles. A good Medigap plan is like building a financial fortress around your health. It makes your out-of-pocket cost predictable and, most importantly, finite. It takes that ticking time bomb and completely diffuses it. So, let's look at what you've built on path number 1. You have a complete, nearly airtight insurance solution. It's a combination of government and private coverage. You have Part A and Part B from the government, and you've added a Part D and a Medigap plan from 2 separate private companies. You now have a higher total monthly premium, but you have something priceless: freedom and predictability. With this combination, you can go to any doctor, any hospital, any specialist in the entire United States that accepts Medicare. No networks, no referrals. The decisions about your healthcare are between you and your doctor, not an insurance company. This is the gold standard for comprehensive coverage. Now, let's back up to that fork in the road and explore the other highway. Path number 2, Medicare Advantage. This path is built on a completely different philosophy. You still have Part A and Part B. You must be enrolled in them. You must continue to pay your Part B premium to the government, but you don't use them. Instead, you choose to receive your benefits through a private insurance company that has been approved by Medicare. This is officially called Medicare Part C, or Medicare Advantage. Think of it this way. Instead of the government paying your bills directly, the government pays a private insurance company a fixed monthly fee to manage your healthcare for you. That company then takes over, completely replacing Original Medicare. You put your red, white, and blue Medicare card in a drawer and start using the insurance card from a massive corporation. Their sales pitch is incredibly seductive. They bundle everything into one neat package. It's an all-in-one solution. Your Part A hospital coverage, your Part B doctor coverage, and usually your Part D prescription drug coverage are all combined into a single plan. And here's the hook that gets millions of people to sign up. Most of these plans have a $0 monthly premium. On top of that, they throw in extra benefits that Original Medicare would never cover. Dental cleanings, vision exams, hearing aids, gym memberships. It sounds too good to be true, doesn't it? So what's the catch? Why wouldn't everyone choose this path? The catch is control. When you choose a Medicare Advantage plan, you agree to play by their rules. And their number 1 rule is the network. You must use their doctors, their hospitals, their specialists. If you go outside their network, you could end up paying for everything yourself. That freedom you had on path number 1, it's gone. Your choice of doctors is now limited to a list provided by your insurance company. and it goes deeper. With these plans, you often need referrals to see a specialist. And more importantly, you may need something called prior authorization for a test or a procedure. This means the insurance company, not your doctor, gets to decide if the care you need is medically necessary. They have the power to say no. Why? Because every time they deny your care, they save money. Their profits depend on managing your care, which is a gentle way of saying they depend on limiting it. This is the fundamental conflict of interest at the heart of the Medicare Advantage model. So now we have a complete picture. We are standing at that fork in the road, looking down two completely different highways. Let's put them side by side, not with confusing jargon, but with the raw truth of what each path means for your life. Path number 1, the original Medicare with a Medigap path, is the path of freedom and predictability. Your total monthly premiums are higher without a doubt. You are paying for that Medigap policy every single month, but in exchange, you have bought peace of mind. You have the absolute freedom to choose your doctors. You can walk into almost any clinic or hospital in the country and know you are covered. Your healthcare decisions are made by you and your doctor alone. And most importantly, your out-of-pocket costs are almost entirely predictable. A serious illness will be an emotional and physical challenge, but it will not be a financial catastrophe. You are protected. Path number 2, the Medicare Advantage path, is the path of low initial cost and managed care. Your monthly premiums are often zero or very close to it. You get attractive extra benefits like dental and vision, which are genuinely valuable. But in exchange, you have given up freedom and control. You are locked into a network of doctors. You may be forced to change the doctors you've trusted for years, and you have placed a private corporation, a for-profit entity, between you and your doctor. They have the authority to approve or deny the care your doctor recommends. Your out-of-pocket costs are low for routine care, but in the case of a major health event, you could face thousands of dollars in co-pays and co-insurance, all the way up to a yearly maximum that can be distressingly high. So what is the choice? It's not about which path is universally better. It's about which philosophy you trust with your life. Is your primary goal to have the lowest possible monthly premium? And are you comfortable with a managed network and the rules that come with it? Or is your primary goal to have complete freedom of choice and the most comprehensive, predictable coverage? And are you willing to pay a higher monthly premium for that peace of mind? Cost versus control. That is the ultimate decision. There is no right answer for everyone, but there is a right answer for you. And now you have the map. You understand the core mechanics better than 90% of the people who are currently navigating this system. You see the two highways clearly. You understand what each one offers, and more importantly, what each one demands in return. This is the foundation. This is the starting point of your entire journey. From here, we can explore every detail, every trap, and every strategy to master this system. But it all starts with this one fundamental choice. Now you have the map. You are no longer lost in the fog. This is the first step to taking control, to making a decision not based on fear or confusion, but on knowledge and confidence. And that is the only way to truly protect your health and your finances in retirement. This is just the beginning. In our very next video, we are going to dive deep into the 5 shocking downsides of Medicare Advantage plans that the commercials will never ever tell you. To make sure you don't miss that critical information, subscribe to the Medicare Compass right now. And just as importantly, click that notification bell. And finally, I want to hear from you. Now that you see the two paths clearly, which one seems more appealing to you at first glance? There's no wrong answer. Let me know in the comments below. And if you found this guide valuable, if it cleared up even a little bit of your confusion, share it with a friend or family member who is approaching this same critical decision. You could save them from making a costly mistake. Thank you for watching, and welcome to the start of your journey toward Medicare confidence.